I'm very happy to introduce our first keynote speaker of the day, and who's going to be talking to us about digital transformation and migration to the cloud. Chris Hutchins from Northwell. It's going to be taking us through this ride. Chris is a senior healthcare leader with over 20 years of experience developing analytic teams, establishing data governance, data warehousing, and business intelligence implementation, delivering solutions focused on patient experience, outcomes, cost, population health, quality, regulatory and risk-based arrangements, revenue cycle, health systems operations. He has extensive experience with organizational transformation and specializes in integrating analytics, IT, and informatics teams across organization lines to improve solution delivery, enabling data-driven insights. Prior to joining Northwell in 2015, Chris served as a deputy CIO at Mass General Hospital, corporate director of business intelligence services, and program director for Partners Healthcare as well for the implementation of Epic. In these roles, he led the implementation of their enterprise data warehouse while overseeing IT support for revenue cycle and business intelligence for the physician organization and its clients. I had a great talk with Chris yesterday, and I have a couple of suggestions also for you to do. He's an amazing person who has great ideas, loves restaurants, so it's a good resource for you guys to reach out to him, whether it's New York, whether it's Miami, wherever he goes. I mean, so you know, if you want to go to a very great restaurant, he also can give you great suggestions. But with that, I want to welcome Chris Hutchins and take it on, G.
Well, I think your introduction answers, how I got this great figure. I do like food, and I like nice restaurants. One of the things that I figured out a while ago, having watched a lot of food TV and other channels, is that if you look up the chefs in the major cities, you'll usually find one of them has a restaurant there. So if you haven't thought of that, check it out. It really helps. But thank you so much for your kind introduction, and thank you for having me. I just was contemplating this morning really what this organization has meant to me in my own career, my own success path. And I just have to say that there's some people in the room that I need to thank. Eric Anderson, for one. Bruce Douglas, where are you, Bruce? There you are. My very first exposure to back then it was HDWA, is because you guys pioneered and you created the opportunity for us to come together and just share our experiences and our learnings and to network and meet people that were trying to tackle the same problems that we're all trying to tackle. How many people are here at one of these meetings for the first time? Can I see your hands? Okay, awesome. I just want to encourage you guys, just take the opportunity while you have it, network and meet people. This is gold for you. Chris Donovan, I saw you earlier. You here? There you are. I met Chris at an event a number of years ago, had the occasion to call him because, like many of you, I was given an impossible task to compare vendor solutions that I knew very little about. I gave Chris a call, and of course he took the call and he connected me with the people in his organization that could help me do this. And I had to put together a very comprehensive analysis for my bosses. And it turned out to be something that led to better trust and better working relationships with my executive team. So thank you for that, Chris. The folks from Intermountain, and what do you say, Brent James? I mean, we all owe him a debt of gratitude. It's unfortunate he's not here because I'd like to thank him again personally. I know I've done it before, but informatics was born really at Intermountain, and some of the relationships. I know, Chris Mitchell. I saw you here. Got to meet you at one of the early meetings, and guys like Lee Pierce years ago. Another one, Colorado Children's. I was speaking with a gentleman from there last night. One of the things that I got from just a simple conversation with a friend that I knew that worked at Colorado Children's was something called the Analytic Resource Center. My struggle has always been, how do you position analytics in a way that people don't feel threatened? If you're in an enterprise role, there's always this, okay, you're going to try to take over the world and control. And I learned from my friends at Intermountain and from Colorado Children's how to position what we do as a service. And we're a resource to you. Now, you can choose whether to engage with us and how you want to engage, but we're here to support you. And so to all of you that have been part of the success that I've been able to enjoy in my career and my organizations have benefited from, I just want to thank you. And to the rest of you, just look around the room. You're in really good company. There's a lot of expertise in this room that you can't buy. So as you're enjoying the presentations and the networking opportunities, really be alert and listen to some of the things that people are talking about. I promise you that there are people who share some of the same challenges. Many of them have gone further than you have, and many of them are probably in the same place that you are, but we can absolutely help each other. So that's my plug for taking advantage of the opportunity. I can't emphasize it enough. So a little bit about Northwell Health. I won't go too much into this because you can certainly look at the materials, but we're spread really across Long Island and into Manhattan. 21 physical hospitals, 23 if you count a couple that are embedded in the hospitals, about 900 outpatient facilities. We essentially have every EMR known to mankind with the exception of Epic. Lucky me. I don't know that that's going to remain true much longer. We'll see. There's definitely some thought now because of, as we heard on the panel, the pandemic certainly accelerated the need for analytics and the proliferation of data and the availability. So we're experiencing some of the same things, many of which have contributed to us really starting to take a good look at how do we do enterprise digital transformation, which we'll talk a little about this morning, cloud transformation, and really just, accelerating, making data available and embedding it to make good decisions in every aspect of what you do as a health system. Again, I won't read all this stuff to you, but it's a big company, bottom line. It's the largest private employer in the state of New York. This is all the sexy advertising, marketing stuff that people get excited about. That's not the world we live in. Aravind and Mike are here with me from my team back in New York. As any of you know that have responsibility for enterprise analytics, you don't do it alone. It's a team sport. So there's a couple things that we're working on. I want to tell you a little bit about it. So you have a chance to, if you wanted to talk to some people who can give you better insight than I can. These are guys who understand it. So dealing with cloud migration, we're going to talk a little bit about that this morning. We're dealing a lot with the development of data literacy content. There's a ton of work going on the modernization of the tech stack overall. But Aravind, could you stand just for a minute and just raise your hand? This is Aravind. He's my right-hand guy. He's a technical wizard. We're dealing with things at a scale that most organizations don't. If we do this Epic thing, we're not in multiple states. We're in one really compact service area, so we will have one instance, not multiple instances. So it's going to be huge. And these guys are and this is my opinion, it's not intended to be derogatory or offensive to anyone. I just think my team is the best in the business. We have high availability, and that's really a tribute to the work that Aravind and his team have done. And the other thing I mentioned, data literacy, there's going to be a lot of talk, discussion around that and governance and education and training. Mike Kelly, could you stand and just raise your hand? Mike is really leading that charge for us. If I'd have given him an opportunity and shared this deck with him, you'd probably be already finished with the keynote because he knows how to do things very concisely and get people in and out and get them educated and equipped. That being said, he's not available, but please do, just chat with him if you get a chance while you're here. If there's things that we can share, we're an open book. Anything that we're doing, anything that we've learned from failures and successes, we're happy to share that with you all. You're all, like I said, you're all in good company. We're all trying to solve a lot of the same things. And I intend on taking advantage of more discussions while I'm here. A great conversation again with one of our colleagues from Colorado Children's, who's in a different place with the implementation of they're actually live in production, as many of you are, on the EMR that we're likely to be on again soon. So again, thank you for that. And now we just kind of get into cloud migration and some of the expected goals. There's not going to be anything earth-shattering here, but you hear a lot of the buzzwords. We're modernizing our tech stack. You hear this in a lot of the executive meetings. What does that actually mean? The rest, people like us can answer that, but it doesn't usually get deeper. So I'm grateful that we're all in a room, because people like us usually are at the tail end of a long day of presentations. You know, data and analytics was maybe the last 5 minutes of an all-day session, right? We got the whole day. And thank you, Alicia, for getting me the opportunity to like lead off the day. That has never happened before. But there's some, I'll call it assumptions. Some of them are good, some of them maybe not so good. But the expectation of reducing the total cost. You want to minimize oh gosh, that's a typo that I just discovered for myself. I need a proofreader. Maximize your 24/7 uptime. Aravind, forgive me. Because Aravin's team is really good at what they do, we have virtually no downtime. We have, you know, SQL always on, and we have almost 100% uptime. We only down if there's a really critical patch that has to be done, and even then it's done, it's very quick. Then virtualization, really to reduce the number of on-prem stores that you have. Those are things that are really expected to be benefits of this. And then improved availability. You know, I mentioned SQL always on. You'll hear some about data virtualization while you're here this week. There's techniques that are used in order to make sure that there's high availability, because as we do what we do, if we're doing it well, the dependency on it continues to really increase, and the organization needs it, and it becomes part of their lifeblood. So this is another step that's supposed to really help us to get there. So talk about some approaches, and I won't read through all of this, but I think there's some of the early things that we started to do were to look at where we have solutions where people are just accessing things for viewing purposes. If it really requires limited action, it's probably a good candidate. Data and analytics typically is that, with the exception of when you've got tools where people are going to do a lot of drill through, and they're going to be, doing egress. They're going to be pulling data down from the cloud. So, Aravin's been really good at targeting the structures and the opportunities that we can push things there, like very well curated data marts that allow you to answer your really the top, 15 or 20 types of things that people are looking for to understand the data. That being said, if you're, working in the finance department and you need to dissect your AR and get down to revenue codes or denial codes, that might not be something you want to start with. It doesn't mean you can't get there, but you want to get, skin your knee on some things that are not likely to be a spike in your subscription cost. Because that's another thing that we'll get into, is there's a shift here. I'm gonna aim this in the right direction. Cost considerations. I put a question mark in terms of reducing the overall cost. The major thing in an organization like we are is we are really trying to make sure that we're positioned well to grow by acquisition. It's a strategy that the health system has. So in order to do that, we have to keep our long-term operating commitments contained. And so when we're dealing with acquisition or implementation of new products, software, hardware, that's all capitalized, including the implementation costs, which means we also have a staffing component to that. When you shift to cloud, it's a subscription service by definition, which means you don't have a choice. It has to become operating. And early on in the planning, there's a ton of questions that come up about that. What does it really mean? What's it going to cost? I think the long range answer to that is potentially it can come down. And the reason I say that, you're dealing with the ability to now turn things off during the hours that you're not going to use them. I won't say it's 100%, but there's a lot of analytics, for example, that no one's going to be looking at between, 11 p.m. and 6 a.m. So you can spin those things down. So you're actually saving costs. If you're an on-prem model, most of them are up 24/7, unless an organization is, progressive enough in their thought processes that they can deal with power ups and power downs on a large scale. But in our organization, there are literally thousands of servers that are sitting in 2 data centers. It's just not possible to manage it that way. So we know that there's going to be a cost impact there. But that being said, we're at a time where inflation is affecting everything. Your kilowatt hours might change, but your pricing might not, because the rates are what they are. We're all dealing with the same thing. So I think that the punchline that I will tell you there is, if you're trying to manage this function and you have accountability for it, you want to make sure that you're communicating, especially with your finance leadership team, on a regular basis and managing their expectations. Because as you're progressing through this kind of a journey, you're going to have overlap. You're going to have some challenges, either purchasing skill sets that you don't already have existing on your team, or you're going to upskill the team members that you do. But you're going to have to keep the lights on your on-premises environments is at the same time you're migrating to the cloud. So your total cost for a period of time, it is going to go up. And at what time it starts to come down, it really depends on which things that you're choosing to migrate. It depends on your contracting with the vendor solutions that you have in the space. And I think probably more importantly, it really depends on their readiness for migration to the cloud. So these are things you definitely want to stay on top of. And again, over communicate, make sure that there's no surprises. You're going to find out what your egress cost is when you get your chargeback in a month or two from now, in terms of what you're utilizing. That's a lot of the stuff to really pay attention to. It's just really the high points. But is there folks in this room that really feel like your organization has progressed? You're at an advanced point dealing with the migration? If I could see hands. No? How many of you'd say maybe you're underway, but got a ways to go? Okay. So there's a lot of opportunity here. But let me just ask this another way. So if you just raised your hand, could you just stand up for a second so people can look around and see you? Because I want to make sure that while you're here, you seek these people out and talk to them. If you haven't started or you're early in your planning, these are people who can help you. It's a great opportunity while you're here. You won't regret it. So definitely please take advantage of that. No, on a similar note, not quite the same, I want to get into digital transformation, what it really means in healthcare. You'll see I've underlined the word meaningful. And as we get into this, I think you'll understand where I'm going with it. But what's the difference? What's your focus? I know, as being part of an IT organization for a long time, it was really about the solutions. It was about the cool technologies. And I know all of us feel some sense of responsibility to make sure that we're staying up on those things, and we're trying to be on at least the cutting edge and understanding what's coming if we're not already implementing them. And that's really important. But what's also important is to understand that because you work in healthcare, by definition, you have a different perspective and you have a different expectation. Who in this room has made a personal phone call or an email to someone to help get access to a provider for yourself, a friend, or a colleague? That's what I thought. Most of the people that are coming through our healthcare doors right now, they don't have that ability because they don't have the understanding of how to navigate. And that's where I think we have to really make sure that we don't lose focus, because we are insiders, okay? This is another thing that you see, particularly in IT organizations, the field of dreams approach. We want to build cool stuff, and then we're hoping someone wants to use it. While it might be fun for some of us that are really a little bit techie, but it doesn't make it meaningful. It doesn't mean that it's going to work. So my question really is it a movie only, or is it really a development blueprint? I submit that it's probably not a development blueprint. That doesn't mean you can't come up with some cool solutions, but I think the sequencing of how you determine where you're going to invest your time and energy is increasingly something you have to pay attention to. If it hasn't hit you this way, I'll tell you how it's hit me. The conversations that I'm having with the CFO and the COO when it comes to budget time, I start talking about what I want to do in the next year, and they say, well, time out. Let's look at your baseline. How much did we spend last year, and what do we get for it? And why do we need to continue to invest at the same levels? Like, well, this is all staffing. What do you mean? Well, nonetheless, we have to be good stewards, and we're here for delivering the best care and the best outcomes. So we need to make sure that we're working on the right things. And so for that reason, we can't approach things this way. And Aravind will tell you, because he's been with me for a long time, we've had to work feverishly to keep up with things that the business is demanding, let alone trying to keep folks at bay. They have really cool ideas that are not based in what the business is telling us they really need for us to address. This gets to a pretty significant risk, and it's really trusting the inside baseball perspective in terms of how we do what we do. How many of you have been in healthcare for, let's say, 5 years? Okay, how about 10? Okay, well, minimum of 10 years. You guys have a perspective that our patients don't typically have. And if you haven't seen, have you seen Moneyball? Who's seen Moneyball? Okay, this is all the exercise I'm going to ask you to do. There's no jumping jack section or anything. But I just wanted to gauge if you folks are going to understand, you know, specifics around this, the context of the story that you see depicted here. In this instance, they were trying to respond to the loss of some really significant star power for the Oakland A's. And you got a room full of people that are experts and have been doing it for 30 plus years. And they're trying to replace superstars. That's their focus. And what they really had to address in this moment was the fact that he's pointing to a guy who came in from an outsider perspective. He came in with an economics degree. And he was trying to get them to see you're focused on the wrong thing. And ultimately what happens in the evolution here is they figure out what's important is winning. And so the audience, in this case, the consumer, in our case, our patients, they want good health outcomes. And so we can do the things that we think are going to be cool and deliver solutions that we think we want. But again, it can be clouded by our judgment having the insider's perspective. So they had to focus on what really is going to produce the wins. It turned out to be runs and getting people on base. What's important to our patients might not be what we think it is. So it's really important that when you're thinking about digital transformation, we have to pause and we have to get that perspective. You have to get creative in ways that you can engage the patient population. You're going to probably need to come up with some cohorts that are willing to work with you to really share their experiences and what they're looking for. We're probably uniquely positioned and we're all required to do patient satisfaction assessments. That's a key piece of information that we want to pay attention to. We've got to listen to what people are saying to us. If you're hearing that there's noise complaints in some of your facilities, those are things we have to pay attention to. If we can reduce the noise factor and we don't use some cool tech to do it, what's the impact of that going to be? If the personalized touch, because we actually know who the patient is and we approach them and we address them by name, what is that impact? What kind of a technology do I need to deploy for that? Right. Another great example is there's some assumptions that we should be enabling people to schedule from virtually anywhere. And if you're on Epic systems, you can pretty much access the schedule to even schedule ancillary services. That's not our position at the moment, but there's some things behaviorally that we need to be able to do. Our organization, I think, we're coming a long way, but as of right now, patients still have to understand a lot more about what they need and what they should expect than what they really need to. I'll give you a good example. So I went to my endocrinologist. Yes, I'm admitting to you, I have type 2 diabetes. You didn't hear it from someone else, so there's no breach. But when I was leaving the office, there was a sign on the waiting room door. It said, all patients must check in the reception before you leave. I turned the corner and the young lady said, Mr. Hutchins, when does the doctor want to see you again? Is it 3 or 6 months? Because she knew I had to be seen at least twice a year. And so right then and there, within a minute or so, my next appointment was scheduled. Well, she didn't have to go check the radiology department scheduling app, or she didn't have to look at any other systems because it was contained within the practice. So the solution in that situation that we can start moving the needle on in our own health system is simply that we just need to know when a patient's being seen. Let's use the data to find out, did their next appointment get scheduled before they left the premises? And if the answer is yes, That's awesome. But if the answer is no, we missed an opportunity. And so we also have a practice manager's incentive plan. We've got a really cool dashboard, has a handful of metrics and some thresholds that they're accountable to meet in order to qualify for some incentive. So I just simply said, well, then let's add a metric to that. We want to know how often patients are leaving their appointment or their next visit scheduled. We want to set some targets. We can drive behavioral change there. It impacts volume. It impacts patient satisfaction, because the alternative is we identify a gap in care, which means we've already missed an opportunity. They're already overdue for something. And we call them and then I can't get them in for 3 to 6 months. That's a bad patient experience. But if I'm in the office and I'm getting the next appointment now, that's positive. That's really what I want. I don't need another appointment today. I just saw the doctor. So there's some things that we just need to think about that are really practical, that are more behavioral oriented than even technology. Not to say we don't need technology. Don't misunderstand what I'm saying, but we need to apply the right solutions that really meet the patient where they are. Because we're inside healthcare and we're used to technology solutions. We think of pretty much everything through a different lens than they're thinking about it. I want to be able to do more with my smartphone, but that doesn't mean everyone does. So here we get to what I think is the punchline. We really want to enable a frictionless patient and provider interaction. The revolution, we call it, from electronic health records, yeah, we've got everything documented. It's enabling the data and analytics that we all do. Certainly enables better documentation, and the bottom line is the billing, more accurate billing and documentation. But in the end, it's not this, it's this. Patients don't typically cite the technology, the data, or especially the analytics is what made their experience really valuable and worthwhile to them. It's the human interaction that they walk away from. And that's what they tell their friends and their family about. And honestly, if we're honest with ourselves, that's the first thing that we talk about too. Even if we saw some cool technology. I mean, I remember the first time I saw the doctor in the exam room, and he was doing all his things in the, I think it was an Epic platform at that point. He was capturing the information as we spoke, which I thought was pretty cool. But still at the end of it, I had a really good experience, really good interaction with the doctor. And those are things that we really want to make sure that we're focusing on. So the solutions have to be targeted, and they really need to be designed around what the patient's telling us that they need, which takes a little bit of extra effort. I don't know that there's any one way to get that kind of input, from your patients, but we owe it to them to figure it out. We owe it to our physicians to figure it out. The physician burnout rate is a big issue. I mean, who's heard that in their own organization? Let me see your hands. We're asking them to see more patients, which means they have to spend more time documenting. There's a program that got spun up in our organization that probably is not uncommon at this point, but it's called Home for Dinner. And it's trying to do things that, whether using scribes, either virtual or physical scribes in the exam rooms, to at least get the high level communications between their interactions documented between the provider and the patient. So that at the end of it, it's a much simpler read through a note to check something off, so that the doctor doesn't have to spend 2 more hours just trying to document everything. And every time we're saying, listen, you got to be putting in more RVUs. So you got to have more visits, you got to see more patients, you got to change your schedule slot durations. All of those things impact their satisfaction. And I don't know, I'd be surprised. Has anyone ever met a doctor who said that they really, really like less face time with the patient? They like having to do the documentation? Yeah, I didn't think so. But that's something for us in the roles that we have the opportunity to really help be an advocate for both sides. And I just encourage you to really think about it that way. The patients deserve that. Think about your friends and family members. One of the things that motivates me every day in my job is that I want to know that I'm doing everything that I can, so that when that provider is looking at my family member or my friend or my neighbor, they have the best information at their fingertips. And it's really, really easy and quick for them to access it so they can make the best decision. And I want the patient to have the confidence when they're sitting there to know that that's the commitment the organization has made that I'm sitting in front of right now. And that's the opportunity that we all have in the roles that we have in data and analytics. It'd be interesting to understand this too. So when you all started, I don't know, let's say when you got out of high school, started in college, who thought you'd be doing data and analytics as a career? Anyone? Are you scratching your head, sir, or are you raising your hand? Okay, let's go 10 years after high school. Who thought it was even a thing to be a chief data officer? We got 1, 2. The good news for all of us is there's an opportunity now for us to have a direct impact on healthcare and the delivery of the care. And it's a privilege. It's certainly humbling, but it's probably one of the most exciting things that we can do. I never imagined in a million years that I could go into data and analytics and even have a career. But I know there's people in this room that are in the same situation I am, where you've grown kids, you've got a family. My 2 sons are grown, they're on their own, they're independent, they have insurance, they're not asking me for money. That's been enabled because I've been given this great opportunity in healthcare to learn how to use data and analytics to support clinical care, and more importantly, to support that interaction between the patient and the provider. I don't know how much better it could get. I'm sure there's people that have great experiences, doing sports analytics. I mean, one of the guys that works for the NFL tags things on my LinkedIn sometimes that I think, how cool is that? I would love to talk to him at some point and find out what his day is like. But what we do is really important. It's meaningful. And organizations are wrestling with the concept of digital transformation. And we've got to get the focus, really, really correct. And it's not, I won't say it's all one or the other. It's a blend, but we definitely want to make sure that we're focusing our attention on solutions that are answering what the patients are really looking for and what the providers are looking for. It's really both of those things together. Because when you don't get those things right, it does not accomplish that frictionless interaction that we're talking about. And let's go back to this one. Building versus buying solutions. I'm going to guess that I'm not the only one in the room that's been in conversations where in the healthcare sector where people have said, listen, we can do this cheaper. We're not going to have to pay for all this other costs, so it's free. Well, nothing's free unless you've got a volunteer workforce, right? And usually what I see in terms of proposals and an analysis going into justifying a build versus buy option is they don't count staffing in there at all. Most of the people that we have working for us doing that kind of work, they're not making less than 6 figures, no matter what part of the country you're in. So you figure out what they're costing you per hour. If you got a team of 6 working for 6 months, what do you think that number is? If the solution you're saying is it's too expensive, it's going to cost you 300 grand, I promise you're going to spend more than 300 grand because you're not looking at the real total cost of ownership. If you look to the right, you see these things: R&D, tooling, equipment, evaluation, bid and award, which is sunk cost if you're purchasing something. All these other components, utilization costs, life cycle costs. One of the battles that I fight always when it comes to budget conversations is that everything that we build has an operating tail. If we're not doing software development, people don't want to hear that. But in the analytics space, anything that you deploy, you have to keep it up and running. You've got data center costs because things are cycling and updating. You've got support costs because it needs to be kept up. And hopefully you've got your team reevaluating things in your production environments on at least an annual, or if not a semi-annual basis, to make sure it's still needed, monitoring if it's utilized or not. People get paid to do that kind of work. It's not free. And just on average, if you just in the basic range, you're probably spending 13 to 18% on average minimum for operating tail in out years after you've deployed something to production. And so if you think about that math, and then you match that up against what some of the solutions you can purchase cost you, it's not even a comparison. But oftentimes those things are overlooked. And so I just really encourage you to take a look at that, because then the other piece of it, the question on the left, how long before a comparable experience will be available if you choose to build it yourself? We had a retreat, I think it was a year ago, December, and there was this, resounding commitment to try to do the right thing and do digital transformation and really do it well. And there was a couple of different things that came out. They were talking about short-term objectives and identifying a patient engagement platform. We have a homegrown thing that's it's decent, but people say, well, isn't that going to be the solution? So I don't think we should assume that, because I know for a fact from where I get my own care, which is telling on myself a little bit, I have a platform available to me that's very, very robust. I can see virtually anything I need to see about my care, the care team. I can communicate with my clinicians. I can schedule my own appointments. How long before we have that in the platform that we're building ourselves? We couldn't answer the question. But the bigger picture is, in the market that we're sitting in, and it probably is the same in your markets, people have access to it already. And so what are we talking about if we're talking about delaying giving them access to what they should already have for, I don't know, 6 years, 7 years to develop something and deploy it yourselves? And in those 6 or 7 years, by the way, the products that your competitors have are continuing to advance. So it's kind of a short-sighted thing to assume that they're not going to be in a very different place by the time you get to where they are. So I'm not saying that's always the case, but it's something you really have to take a hard look at when you're making those decisions and challenge the thinking in your organization. I don't know, are there any CIOs in the room? Okay. One, if you're not the CIO, then you probably have the opportunity and you have a need to make sure that you're providing some good input when there's opportunity. I don't mean barge in and insist that you should be seen in the CIO's office. That's not what I'm saying. But look for those opportunities where you can have a voice to really challenge the status quo. Make sure that you're looking at these things from the right perspectives, because the answer is not always, it's not always the obvious one or the easy one. I know what we're assessing right now is a pretty dramatic shift in our own organization, but we're looking at it realizing that the cost of not doing it is something that we're just not going to be able to afford. And the primary reason for that is in the marketplace where we live, this high expectation. And people have options, consumers have options. So we have to make sure that we're paying attention to those and just be really, really honest in terms of how we're assessing the cost, the value opportunity, and the risks. And that gets down to even back to the stewardship, when I was talking about my meetings with the COO and the CFO. What's your approach to determining where you put your time and energy and resources? And what we're really trying to dig in on now as an organization is value creation, improved outcomes that are measurable, whether it's reducing cost or certainly in some cases, we're talking about compliance and regulatory. Yes, those things are the necessary things that you do. But there's a lot of time spent on satisfying curiosity sometimes. That's not really meaningful in the sense, unless it, of course, changes behavior or it can impact an outcome. So for us to be effective, we have to really partner with the business and make sure that we're asking those questions when the things are coming in, the intake valves. We have a variety of them probably in every organization, but we really want to make sure that we're assessing those to determine, are we using our resources on the things that are most pressing and most important, not only for the health system from a strategic perspective, but from the provider patient experience perspective. And that's not an easy thing to do because people get excited. I don't know. I did something early on when I got to Northwell that I've regretted a couple of times not pushing harder on, but initially I allowed the brand of a couple of tools to be put into our analytic portal. And so now I start getting requests for a Tableau dashboard. Who gets asked for that? Or a Power BI dashboard? The value is not the tool. That's no disrespect to the people that have created them. But the value is, do we give them something that they can act on And is it going to change behavior? Is it going to enable a more efficient workflow? And, I bet you I'm not the only one that has seen lists produced using a BI tool that it didn't really need. We actually have something in our environment. It's called a list app. When you look at what it really does fundamentally, it just enables, it's a simple UI to query data and spit out a list. I think we could do that with a SQL query. We could probably send it to a printer, right? We don't need apps for that stuff, but we over-engineer solutions because we like to do cool stuff. We like cool tech. But that's just another example of maybe not getting people, I hate to use the word educated because it sounds condescending and I don't mean it to be that way, but we need to educate them in terms of what we do and make sure that they understand we're here to support you. We don't need you to tell us the solution. I've got people that all they've ever done is optimize data sets. I've got people, the only thing they ever known how to do is create really good visualizations. I got people who can do ETL development that's unbelievable. Our data architects, they're ridiculous. We're talking about career level commitments these people make and the skill sets that they have. And so if I can just get our consumers, our colleagues to just come and tell us what's the problem or challenge you're trying to solve for, and let us take it from there. And we'll give you options. We'll give you choices. But the answer is not always going to be something cool and sexy. It might be something that just enables a simple embedded decision-making tool at either the point of care, or it could be even in the admitting office. But just making sure you've got the right solution in place at the right moment to enable a good decision or to enable another outcome. So, I mean, that's one thing I'd encourage you guys to really think about is, how are you conditioning your organization to pose their questions to you? And how are you helping them to assess what the right solution is? You want to make sure that things are measurable. I can't get away with saying, listen, we deployed all these tools and our utilization numbers are crazy. I get 20,000 views of this one tool last month. Yeah, well, what did it change? Were they able to get a better outcome? Were they able to drive efficiency in the operation? What is it doing? And those are the harder questions that we have to ask. And that really requires a deepening of our commitment, not only to the work that we do to our patients, but also to our business partners. Because as a person doing analytics, I don't necessarily have all the insights I need to be able to quantify the benefits of what I deploy. And that's the challenge. And so the partnership approach that we're taking now really is intended to open up those conversations and get the business to help me identify what success looks like, how we're going to measure it. Then they're going to be the ones to measure it. Because guess what? When the benefit shows up, it doesn't hit my cost center. I still look like a cost center. The benefit shows up in somebody else's revenue center, right? And so when I'm being asked, how do we know that we're working on the most high priority things for the health system? I really have to have concrete information, but it has to come from the business partnership. It has to come from the places where they're measuring the impact of what we do. So it's no longer enough to be able to speak about all the buzzwords. Say, you're doing predictive analytics? Yeah, I predict we're in a whole lot of trouble if we don't start figuring out how to produce measurable value. But I say that in jest, but the reality is we do have to do predictive. We do have to do all of those things. We do need artificial intelligence and machine learning, and you're going to hear probably some really great use cases and ways to approach that while you're here. But the most important aspect is, why are we doing what we're doing? What is the real goal and objective? And keep our eye on the ball, because it's really up to us to do it. We're the ones who wake up in the morning thinking about how we're going to use data and analytics every day to make things better in every aspect of what we do. And it's an incredible honor. It really, really is. I mean, I had a moment, went to a business meeting a few years back, working for another company. And I just had this moment of reality that I was in a place representing a company that had a reputation I had nothing to do with earning. And I realized I don't have the right to jeopardize it by anything that I say or do. And I won't answer a question I don't know the answer to unless I'm saying simply, I don't know, but I'll find out for you. That's an incredibly important thing for us to remember. The role that we have is not insignificant. You're representing a patient and a provider relationship. And the work that you do is absolutely essential, and you can and will make a difference. And you're already making a difference, probably in ways you don't even know. But I think that the opportunity is probably underestimated. I know it has been by me at times in my own career. The frustrations of dealing with the day-to-day challenges, the things that get lobbed over the fence because someone high enough in the food chain says do it, you've got to go do it, even though you question the potential impact or the value. Those things happen. But by and large, the impacts we can have are going to be coming from the work product in the business relationships that we build. And I'm not talking about the dashboards, the reports. I'm talking about the rapport that you build with your colleagues and your business partners. And that's really not partners, I don't think is a light term. Because I don't think we can be really that successful if we don't develop partnerships and relationships. Data and analytics is cool, but the best result is going to still come from people and relationships. We've got to make sure we invest time there, because trust is not going to be given easily. You've got to earn that. And oftentimes that comes through being really transparent with people. And when they're posing challenges to you, admitting, I don't really know, but I'm happy to work with you to figure it out. I don't know is another question that another answer I usually keep in the front of my mind when I'm trying to figure out who to hire. I look for a good opportunity to put a question in the interview process that I know for sure no one's going to know the answer to besides me, because it was maybe something that I did myself and no one ever knew about. Because you want people that are going to be willing to say that. And listen, I don't know, but I'm happy to partner with you. We'll get you the answer. But that business partnership is why I think we're having the successes that we're having. Again, not because I thought of it, but from the inspiration I've gotten from many of you in this room. And just really, how do you engage with the business? How do you enable them to have access to the things that they need at the point where they really need it? And it comes down to listening to the business needs, listening to what the patient needs, listening to what the provider needs, and really dedicating yourself to finding the right solutions. Don't make the assumptions. A cool, sexy dashboard is just that. You could put one together for your fantasy football team if you like fantasy football, but I tried doing some goofy things like that, and I still didn't win my league. So the tooling in and of itself is not really the piece that's the most valuable. It's really what you bring to the table as a business partner to your colleagues, whether you're working as an analyst, a data scientist, or you're in a managerial capacity. You might even be the chief. Those partnerships and relationships is really what makes all the difference. If you want to do digital transformation successfully, you can't really neglect those things. It's a team sport. I wish some of my other team members could be here so you can meet those guys as well. This is a team sport for all of us. I suspect none of us are here representing the 0.5% of people who say they're self-made. I don't know if there's even a 0.5% if we're honest with ourselves, but we do need each other. And again, this is a great opportunity while you're here this week. The people in this room are going to be a great help to you if you take the time just to get to know some folks, I promise you. How are we doing on time, Eric? Oh, wow, this is perfect. So I think we've gone through the majority of the content here. I want to leave this last one up while we talk a little bit, but I'd love to pause here and get some of your thoughts, reactions, or questions and things that we can talk about, because I really want to make sure that we all walk away with something from this session and actually from the whole week. Please stand up and be as loud as you can. It's a great question. What kind of cloud are we migrating to? I think probably like most of you, it's not one answer. We've started, focusing on with the Microsoft Azure platform, primarily in our organization, because that's the first organization that was willing to go through the contracting exercise to get all the legal language in place, indemnification, PHI, all those things had to be accounted for. But recently, we've also announced an engagement with Google If you listen to them, they think that they're going to be our primary and only cloud vendor. If I have any influence on that, that will never be the case, not because it's Google, but I don't want to put all my eggs in one basket ever. I just think from a business continuity standpoint, that's probably a bigger risk than any organization wants to take. But Microsoft was probably about the easiest to get through some of those negotiating challenges with. I think largely because, like most organizations, you probably have a pretty substantial enterprise footprint with them. So it just seemed like that was an easier negotiation. It's good to see you again. I saw you in Boston last month.
Have you found any magic bullet tool technique to get over the hump of master data management, really applying that master data?
I wouldn't say it's magic. And if you didn't hear the question, is if I found the magic tool to deal with master data management and all the challenges in getting really implementing the tool. I think it gets down to, in our case, getting the right person to really kind of take the ball and run with it. In this case, it happened to be somebody that I knew from working with for a long time in the organization that had the ability to navigate, had some people skills. And if you have people that work for you where you know that you can just say, listen, here's a challenge, I don't know much about it, but you can hand it to them and they can go run with it. And you know that person's going to run the thing down and they'll be an expert in no time. That's the person you're looking for to champion this kind of effort, because they got to have good people skills. That's probably the most important thing, because you can find people that can deal with the data, but that navigating the relationships and the communication is probably the hardest part of it. And the other thing, by the way, we're using IBM currently. I'd be lying if I didn't tell you that Google's pressing me that they have a better tool. We'll see. But I know that the people part of it is probably the hardest thing, because you've got to know who are the ones that can engage, that have to be weighing in on the decisions. Are they accountable? Are they responsible? They need to be consulted or informed, right? In a big organization, unfortunately, you talk about one data domain like pharmacy, you might have 20 pharmacy directors that have to be part of a conversation to get to, what standards you're going to use and how you normalize. So it takes somebody who's comfortable with, really getting people together, articulating the challenge, making sure that they understand we're not talking about something that's theoretical or academic. We need you to come to agreement on this because we have to put this into our platforms so that we can measure the things that you're telling us you need us to measure for you. So that doesn't answer specifically, the magic bullet, but again, I think it's really about getting the right person to drive it for you. Bruce? Thank you.
And the need to be responsible stewards of our. Oh, sorry. Should I start over? No. So there's
start with the part where you like what I said. No,
you're great. That's what I want to say. So I see this increasing tension between the need and desire to innovate and the requirement to be careful stewards of our organization budgets. Can you talk a little bit about, is there ever a case where you say, yes, we need to build that? How do you, or is it always by?
There's definitely cases where we do have to build some things. I think in our organization, I'll give you a couple of examples, because I didn't have the ability to go and say, okay, guys, look, we need to get on a common platform like yesterday. So go spend $100 million or even more and make it happen. So there are bridge solutions that we've had to develop, and not even realizing they are bridge solutions, frankly. One of the things, we have 2 EHRs owned by the same company, that really don't integrate very well. And so we've built some things that allow certain data elements from the ambulatory record to actually flow into a user interface that we've created in the inpatient record, and vice versa. Those are things that the only way to do it was to just deal with it ourselves, because we did have access to the real-time replicated copies of the databases. And I say that and it sounds like I know what I'm talking about, but everyone knows how to do this stuff. I just know how to say the words. But to make sure that we're curating the right data elements, connecting it, and just making it available, so when the doctor needs to see it, he can just click on an action button and he can see the information. That's a great example. There are other instances. Real scenario, when I was working in Boston, I inherited a development team, and they were working on a bank reconciliation tool. They've been doing it for 2 years. And when I looked at it, the cycling was just going over and over again. The business was always coming up with new things. Like, this project doesn't have an end date in my lifetime. And I started to look at what the monthly cost was, and it was ridiculous. So I went to the CFO and I just asked him, can I have your permission to get one of my BAs to go investigate the market? I bet you there's a Fortune 500 company, maybe even a Fortune 100 company that already does it. And lo and behold, we found a solution. And it turned out that that particular company was also the one that did the reconciliation for our bank. And so after 2.5 years, we were doing about a 50% auto match rate on bank transactions from the bank record to our accounts receivable platforms. We implemented this thing, and within 90 days, we're over 90% auto match, and we got to 95% in 4 months. And so they redeployed about 6 people who are doing all that manual effort to some more meaningful things in the organization. It's not always one or the other, but it's really just kind of examining what you have the ability to do from a bridge strategy. And sometimes the answer is, if you've got some deficient systems and the price tag is too big, if there's things that you can do, those are things you probably want to assess and try to get those done. But don't hurry too much, because in the off chance you might be able to influence the bigger decision. If the problem is big enough, maybe at one point the light will go on and say, okay, we can't afford not to do this anymore. Another one? Go ahead.
So in the organizations, how are you navigating between CapEx to OpEx? So when you are migrating to cloud, you're justifying a project or initiative. So how are you navigating from the CapEx to OpEx when you are having a conversation with the finance team?
It's challenging because they want specifics that are hard to give them until you actually get some experience under your belt. But most of your finance executives will tell you that if you want to switch to the cloud, it's an operating expense. It is subscription, and you're paying for what you use, which really defines it as an operating expense. So it's really about being transparent. I mean, I wouldn't recommend taking one of your highest volume transaction systems and starting with that, because you're going to find out within the first month to 6 weeks how expensive it was, and you won't like the number, right? So you want to start with things that have lower IO, input outputs, to really get your feet wet and get some experience under your belt. We're in the process of identifying a couple of use cases in the Google platform to really assess the performance of the platform, but also to assess that egress cost. If we can get a couple of months under our belt and it seems manageable, then I can figure out, okay, where can we ramp it? Some of your heavier research functions, I wouldn't start there either. Researchers typically want to have a very, very large data set to fish from, so to speak. And that can really require a lot of, again, high input output, back and forth transactional communication, from the cloud to the personal computer, or might even be a hybrid situation where you're using on-prem servers.
Thank you.
Yeah, it's a great question. It was regarding whether we engage patients or family members in terms of determining what we do. Yeah, we do have a team. I think they've been rebranded now. It's the, gosh, what is it now, Irvin? I can't remember. Anyway, we were calling it Digital Patient Experience, DPX. That was the team. But they're really the ones that are working with folks in the business to determine, how do we find those groups of people that we can engage. And oftentimes we'll pick a practice or two, and we'll have that dialogue with the patient when they're in the office, and ask them if they'd like to be part of a pilot program, and so that we can get their involvement. And generally speaking, people are interested in doing that, which, interestingly enough, our research division is doing something comparable in terms of educating our patients, giving the opportunity to opt out of research rather than opting in. And it's really framing this as a partnership, the research engaged patient, so that they can be part of contributing to the furthering and advancing of healthcare. Most people, if they understand that, they want to. But I think that's an interesting way to approach that dynamic where, while the patient's there, give them an opportunity. But you got to be really concise with your messaging, make sure it's easy for the front desk person or the provider to frame it so a patient can understand and make a good decision for themselves. A question here?
Yes, Helen Fitzgerald, Michigan Medicine. I appreciate that you talked about the challenge of bringing folks along with you. So I'm thinking in terms of change management. Did you have any messaging that really resonated with different groups? I'm guessing you wouldn't have one message that was true for all, but is there anything that you can share that was really useful in helping other folks understand why we're making this change and why we need to sometimes compromise in order to make it successful?
That's a great question. I don't think it's not really a global messaging that we did. It was more of a grassroots approach. And early on, what we tried to do, we targeted a couple of parts of the business that we knew were heavily engaged because they were asking for really interesting things, and we were starting to get some results. And after we did things, particularly with our pharmacy team, at one point they said, "Chris, we've got some good results, but how do we sustain that?" And I said, "Well, I have a really good answer for you. We need to ensure that we've got the right resourcing to continue the progress." And at that point, they had essentially gained a $15 million sustained increase in their revenue because of some work that we did with them. And so they said, "Well, what's it going to cost?" I said, "Actually, it's small money. You get me one more developer, we can increase the velocity of the work and we'll continue it." And they jumped at the chance. And lo and behold, they started telling everybody. Then all of a sudden we had service lines lining up that wanted to work with us, engage with us the same way. And I think we probably have 5, 7 or so people working in our team that are being funded by the business because they're seeing results that they can measure. And so they're doing all the advertising, which, my CIO at one point told me, he says, "Chris, you don't do a good job marketing the services." And I said, "If I start doing that, you're not going to be thanked in the hallway for the great results. You're going to be told we're not getting everything that they need." And there's a balance. You do want to market the service, but you want to let the business do the loudest talking that's getting the benefit from it, so that they're selling it as a partnership, as opposed to, "Yeah, these guys can do anything. We can't do everything." Yeah, it's maybe time for one more. There's one over here.
Is that on now?
There we go.
Okay, sorry. So I really liked the point you made about measuring outcomes with everything that you do with analytics. I find it's very challenging to put that into practice. And you also mentioned that, you're always getting dashboard requests. And we're in a process at the Ottawa Hospital where we are, with a new Epic implementation, we were really at a lack of dashboards for service lines. So we're going through a process for taking in all this onslaught of requests from different service lines. Can you speak to how you prioritize or create an outcome assessment framework for building those dashboards, which are often like performance trending dashboards or things like that, where people want to measure their key performance metrics.
But there's really two different ways that we do it. Part of it's in the initial conversation. So the intake process captures specific sets of criteria that we need in order to at least get to a high level understanding what they're asking for. But then we engage with them a little further. There's really a communication. Our structures around like the service line support is we have a designated lead who's their conduit. And so they know you don't have to wait for a manager. You can communicate directly with them. But that relationship's really core to getting to that assessment process to determine what's the outcome that we're trying to achieve and how are we going to know if we hit that target and achieve it. For things that are larger than that, we have some templates that we use that really identify who the key stakeholders are, who's the business sponsor, and it can't be me, and it can't be an IT person, it's got to be somebody in the business. If it's a clinical use case, it's got to be a clinical leader who really owns that. But then you start going through what are the core success factors that you're trying to achieve, and how do you measure them, and who owns the responsibility for the measure, and how frequently you're going to be updating it, how are you going to update it. Then there's another level down that gets into the specific data domains and the data classifications. You've got your proprietary stuff, your confidential, your highly confidential, and your, what's the other word I'm looking for? Compartmentalized. Like you can look at clinical data, but you can't look at clinical data for malpractice claims. That's an example of the last category. But then you look at then you're looking at personas that actually are going to be accessing it and figuring out what level of access is appropriate for them. So there's a whole process. It's not only geared to determining how you're measuring success, but it's determining how you're going to implement the thing and what does your team need to know to deploy the proper solution. But it absolutely is a dialogue, and it's a change management challenge, just getting people accustomed to engaging in that way. But again, you start to have a couple successes and it just quiets the noise and people start to get comfortable with engaging. I think that's all we have time for, but I want to thank you guys for your time and attention. And I hope that you have a fantastic week while you're here. And again, another shameless plug while you're here, take advantage of the opportunity to talk to your new friends. All right. Thank you.
Thank you, Chris. On behalf of everybody at HADA, we want to thank you for your participation. And I think it's fantastic. Thank you for your speech. And it is great to know that we're all in this together and that we're all having the same challenges, no matter how advanced you are, how small you are, how big you are. Analytics is here. So I think that we get a very good message that, it's a data analytics it's a discipline that it's here to stay in healthcare. And the need of all of us is it's there. So let's hope that we can do the right thing to continue to improve patient care, which is, I guess, the intention of all of us as provider organizations and healthcare organizations. Thank you so much, Chris, again.